Hello, my name is Asha Henry, and this is a PSA to raise awareness about students with high incident disabilities. Students with high incident disabilities make up most all students with disabilities. Many students with high incident disabilities share some of these characteristics. One, can be difficult to distinguish from students without disabilities, especially in non-school settings. Two, often show mixtures of academic, behavioral, and social problems. Three, can meet the same standards as students without disabilities when structured interventions are put into place. High incident disabilities include the following idea categories: speech and language impairment, communication disorders that adversely affect an educational disorder for a child include stuttering, impaired articulation, and language or voice impairment. Learning disabilities, also a disorder in which one or more of the basic physiological processes involved in understanding or using spoken or written language. Examples of learning disabilities include dyslexia and developmental aphasia. The third definition of a high incidence disability would be an emotional disturbance, which is a condition exhibiting an ability to learn that cannot be explained by intellectual, sensory, or health factors. This includes an inability to build or maintain satisfactory interpersonal relationships with peers and teachers, a general or pervasive mood of unhappiness or depression, inappropriate types of behaviors or feelings under normal circumstances, a tendency to develop symptoms or fears associated with personal or school problems, and schizophrenia. We want to note that students with high incident disabilities have an average to below average functioning IQ of 55 through 70. For this PSA, we will focus on dyslexia and how we can teach students with dyslexia better. Dyslexia is defined as a learning disorder characterized by difficulty reading. Symptoms include late talking, learning new words slowly, and in a delayed manner. People may experience dyslexia cognitively, which affects their difficulty memorizing, spelling, thinking, and understanding, or developmentally, which affects learning disabilities or speech in a child. Dyslexia cannot be cured, but treatment may help. Most children diagnosed with dyslexia can succeed in school with tutoring or specialized education. There are therapies such as rehabilitation, occupational therapy, and counseling psychology, as well as other treatments such as individualized education interventions that may help people with dyslexia. General accommodations and modifications for students with dyslexia include fostering learning skills. We have to praise our students for good listening skills to reinforce the concept. Teaching listening skills and modeling appropriate language also helps our students understand the importance of listening. Making changes to the classroom environment can be effective because each child we teach is different. Changes in seating arrangement and availability of resources may be a factor in keeping students on track. We must engage our students in meaningful tasks. Students who are motivated to engage in learning more often will be more excited to do so when prompted. We must create opportunities for social interaction within the classroom. This allows for students to learn from each other. We also want to create a behavioral management system This sets clear rules, guidelines, and consequences that the students must follow through. It may also benefit our students if we use a tape recorder to improve their reading skills. Students are able to read the printed words silently as they are presented on tape. We must clarify or simplify written directions. We also must be mindful to provide a small amount of work. The students may be anxious about the amount of work to be done. For example, the teacher can request the student to completely fill out the page or select a few of the problems for them to continue. We must also block out extra stimuli in the classroom. If our students are easily distracted by visual stimuli, a blank sheet of paper can be used to cover sections of pages not being worked with. All of these techniques are techniques that would be useful in teaching a student with a high incident disability, such as dyslexia. This is Asha, and I appreciate you letting me aware you to high incident disabilities. Thank you.